Welcome to Module 4 of our series on creating gender-affirming healthcare environments for optimal HIV care. I am Andy McCrae, Scientific Director for the Annenberg Center for Health Sciences. My pronouns are he, him, his, or anything respectful. And in this module, we will delve into the steps you can take to create gender-affirming clinical care for your transgender nonconforming patients. Trans or gender nonconforming patients experience complex intersecting life experiences, which involve social, personal, legal, spiritual, behavioral, in addition to medical management issues. Nothing is standard in this journey toward recognizing and expressing one's gender identity. As healthcare providers, we must demonstrate an understanding and have a sensitivity for the unique transgender nonconforming life experiences and how they impact the health status of every trans patient.
So at that time, my ID, my driver's license, still said female on it. And so I had to kind of, under my breath, hushedly try to explain to them, I'm here as a trans patient. I know that my ID still says female on it. I identify as male. And since the staff really didn't understand what I was saying or really try to understand that, it was more of just sort of like leering looks, like, well, what do you mean? Who is this in your ID? Obviously, I looked a bit different than I looked when I had my ID picture taken. So trying to explain that in the front office window when you have other people sitting behind you, it's kind of difficult. It's difficult. That made me feel like I wasn't valued. It made me feel like they weren't ready to help me in any way, in any real way. And it made me feel like I didn't want to come back to the doctor, that I would just kind of risk, my health in order to just stay feeling like I could be myself. In that instance, I didn't feel that I was a valued member of that society, so I didn't want to come back to the doctor at all, actually. Part of the concern for me was, disclosing my identity in a place where it didn't seem like they were really familiar with anything having to do with my identity at all. And what the impact of that would be, not only in that immediate environment, people sitting behind me not knowing how they are going to react to a trans person being in the room, or knowing, my business necessarily, but also, what impact is that going to have down the line? If this is how I'm being treated now, if I do have a serious, medical emergency, can I count on this doctor's office to really be there to help me? I didn't feel confident in that. And so that relates back to what I was saying about not wanting to come back to the doctor, which is always a risk, because if I need something, or if any trans or gender nonconforming person needs medical attention and they feel that they can't even go to their doctor, they're risking their health in a major way.
Addressing these trans-specific social, behavioral, and medical experiences is crucial to reducing social marginalization and discrimination. And as healthcare providers, we must meet transgender patients where they currently are. What we are really talking about is delivering culturally competent, gender-affirming, patient-centered care, and the good news is, if you make an effort, it can make a real and positive difference. So what does it take? Gender-affirming care involves providing affirmation on social, legal, behavioral affirmation, as well as through medical care and surgical care, including hormone therapy and referrals for gender-affirming procedures. It involves creating a safe, welcoming, culturally sensitive, and inclusive environment that fosters the establishment of a trusting patient-provider relationship. Gender-affirming care engages transgender and gender nonconforming people in health-seeking behaviors. And it promotes engagement and retention in HIV care, which improves health outcomes and quality of life. In a previous module, we talked about healthcare disparities, such as denied access to healthcare and serious healthcare discrimination trans people experience. These are principally the results of cultural insensitivities from privileged people like us, who have not experienced what it is like to be a trans or gender nonconforming person. This privilege comes with blinders, We don't see or feel what is outside our own experience. Privilege doesn't mean you are rich or that you have never worked hard or struggled. All privilege means that there are some things in life you will never have to think about or experience just because of who you are. In this picture, let's assume that this is a cisgendered male who is straight. He can see just fine, but there are a whole lot of things outside his blinders that he doesn't even know exist. For example, just 4 short years ago, there were 29 states where you could be legally fired for being gay. And there were 34 states where you could legally be fired simply for being trans. So for this cisgendered straight man, these are realities he has never experienced and does not need to worry or think about. He is not going to be fired because he is straight, or he is not going to be fired because he is a cisgendered male. So if we want to be part of making a change to diminish these disparities, we need to become more than just accepting. We need to become allies of the transgender nonconforming community, and that means making an effort to remove our own blinders. Being an ally is about supporting a group that has been marginalized, not merely accepting the trans and gender nonconforming community. Being an ally is an active state, not a passive one. And one of the most significant actions we can all take as an ally is to become aware of how our use of language affects other people. Asking and correctly using someone's personal pronoun is one of the most basic ways to show our respect for someone's gender identity. We can't always know what someone's pronoun is by looking at them. When someone is referred to with the wrong pronoun, it can make them feel misunderstood, disrespected, invalidated, dismissed, alienated, unwelcome, or all of the above. It is a cisgender privilege to not worry about which pronoun someone is going to use based on how they perceive your gender. If we have this privilege and fail to make the effort to respect someone else's gender identity, it is not only hurtful, it is oppressive, and a principal cause behind the healthcare disparities transgender or gender nonconforming people experience. Let's take a moment to talk about pronouns and how we use them. We are all familiar with using binary pronouns such as she, her, hers, and he, him, his. We understand these to convey feminine and masculine meaning. But for many transgender, these binary pronouns are alienating. Many transgender or gender nonconforming people prefer a gender-neutral pronoun that does not label them masculine or feminine. They replaces she, he. Zir or here is used instead of her or him. Zirs or heres is used rather than hers or his. Not all transgender or gender nonconforming people prefer they as a pronoun. Some prefer to use they, them, and theirs. This is a pretty common gender-neutral pronoun. And yes, it can be used in the singular. It will feel awkward at first because it conflicts with our familiar use, which reserves they, them, and theirs for plural, not singular use. Some people prefer not to use any pronouns at all. Instead, they would rather use just their name. This may also feel awkward. For example, rather than saying, Andy ate his lunch because he was hungry, in contrast, using name as a pronoun, you'd say, Andy ate Andy's lunch because Andy was hungry. So how do you know which pronoun to use? Just ask. For example, in a social setting, you could introduce yourself with your name and pronouns. Hello, my name is Andy. My pronouns are he, him, his. What is your name and what pronouns do you use? It can feel awkward at first, but it's not half as awkward as getting it wrong or making a hurtful assumption. It is okay to forget someone's pronouns, and it is okay to say, can you remind me of your pronouns? Many transgender people use names that differ from their legal name and the pronouns that match. Their gender identities may not be consistent with the gender marker on legal documents. Using their legal name or incorrect pronouns can instantly damage the patient's experience with the care environment and the provider. It is important to be respectful of people's names choice, no matter what name they choose to use. Ideally, this information would be collected from all patients and included in the electronic health record so that all those involved in patient care are aware and can participate in creating an affirming and welcoming experience. If EHRs are not configured to capture this information for trans patient, use alias along with social history free text to document this information. Changing our use of pronouns will require an effort, and it will feel awkward at first. However, it's important to be respectful of people's name choice, no matter what name they choose to use. Collecting information on gender identity, name, and pronouns systematically from all patients at the time of registration can help ensure that staff members use the correct names and pronouns for patients. This is particularly true in a healthcare setting. Many healthcare practices that are competent in serving trans and gender nonconforming patients have very defined check-in protocols that go something like this. As a patient approaches the reception desk, the receptionist greets them saying something like this. Hello, my name is Miguel. My gender pronouns are she, her, and hers. Would you like to tell me your name and your pronouns today? Patient who presents masculine states, my name is Bill and I prefer he, him, and his. As the receptionist listens, she notices that the chart information indicates Anne as the name and sex is listed as female. Obviously, none of this matches Bill's gender expression. The receptionist then asks, would you like me to update your chart with that information today? Again, this will feel awkward at first, but it is foreign to our experience, especially for the majority of us who are cisgendered and heterosexual. Just keep in mind these best practices. When unsure, start neutral or use their name if you know it. And when you have an opportunity, ask. It is also important to check in regularly with patients regarding chosen name and pronoun. What if you make a mistake? It's okay. Everyone slips up from time to time. The best thing to do if you use the wrong pronoun for someone is to say something right away, like, sorry, I meant she. If you realize your mistake after the fact, apologize in private and move on. It can be tempting to go on and on about how bad you feel or how hard it is for you to get it right, but just don't. It is inappropriate and it makes the person who was misgendered feel awkward and responsible for comforting you, which is absolutely not their job. Knowing a patient's sexual orientation and gender identity is critical for providing integrated, patient-centered care that is also gender-affirming. A two-step gender identity and assigned sex at birth questionnaire has been adopted and endorsed by researchers and experienced trans healthcare providers. As illustrated here, the first question asks about current gender identity, and the second question addresses self-reported sex assigned at birth. This two-step intake approach performs well and has high sensitivity and specificity among both cis and trans individuals. There is a strong consensus regarding the importance of collecting information around sexual orientation and gender identity if we are able to provide patient-centered care and improved health outcomes. In addition to gender identity, collecting information on sexual orientation is vital to analyze the needs of transgender nonconforming patients, evaluate their care, and foster opportunities to reduce and eventually eliminate the healthcare disparities experienced by this population. Based on their life experiences, it is important to remember that some trans or gender nonconforming patients may be reluctant to disclose sexual orientation and gender identity due to confidentiality and privacy concerns. However, the patient-provider relationship and care are enhanced by being aware of and supportive of a patient's sexual orientation. Discussing sexual behavior can be difficult, and it requires a sensitive approach. What are acceptable ways to ask sensitive questions and have gender-affirming discussions with patients? Begin the conversation by addressing confidentiality issues such as, I will discuss some sensitive topics and I want you to feel comfortable. I don't want to assume anything. Do ask about chosen names and pronouns politely and make an effort to use them correctly. I will be asking you questions about sexual behavior. If you would like me to use other words to describe body parts, please let me know. Having these discussions facilitates a more accurate initial assessment of self-reported risk behaviors and health, and most importantly, will foster a more trusting patient-provider relationship initially and over time. National guidelines do exist on how to take an accurate sexual history, and they do include transgender men and women as special populations. The Fenway Guide and the Center of Excellence for Transgender Health Guidelines for the primary and gender-affirming care of transgender and gender non-binary people both suggest sexual risk assessment questions that include anatomy-specific sexual behavior questions like those listed here. These questions are part of a larger sexual history which includes relationships, frequency, sexual behavior, use of alcohol or drugs, and sexual function. Sexual behavior exists on a continuum, and asking about sexual behavior is an important part of a primary care visit. A successful sexual risk assessment will help determine a patient's knowledge level, will help determine appropriate prevention messages, and will help determine the need for HIV and STI testing. Let's recap by reviewing some best practices. Use inclusive intake forms to set the tone for more effective patient-provider relationships by showing respect for the patient's gender identity. Train all frontline staff on trans-inclusive policies, including chosen name and pronoun. During the intake, use the patient's chosen name and pronouns and show empathy, open-mindedness without passing judgment, as you would for any other patient. A comprehensive health history conducted as a gender-affirming open dialogue with patients about their gender identity, expression, sexual orientation, sexual practice, social history, as well as medical surgical history, provides more effective patient-centered care. Ask open-ended questions. Use gender-neutral language such as partner or significant other, and echo the patient's own language and body terms. Recognize that hormonal therapy is a priority for many transgender non-conforming patients. Be aware of hormone protocols and risk benefits. Hormone levels are routinely monitored for gender-affirming care. Provide reassurance that PrEP, or pre-exposure prophylaxis, which is a daily antiretroviral medication to prevent HIV, does not affect hormone levels. Conduct appropriate HIV STI screening based on risk assessment. Discuss safer sex techniques. Be prepared to address STI questions and HIV transmission risk. If you've made it this far, we have made a big first step together on our journey to provide optimal care for our trans patients. As patients, we all want to be treated with respect and awareness of how our life experience affects our overall health. We know that providing the best health outcomes possible for our patients requires us to foster trust, retain patients in appropriate care, and engage them in more health-seeking behavior. For our transgender and gender nonconforming patients, this means we must recognize the many social, personal, legal, behavioral, and medical challenges around their gender identity that most of us will never experience and many just don't see. It begins by asking about and using their chosen name and pronoun, and by employing inclusive gender, biological sex, and sexual orientation forms. If we do that, when our transgender and gender nonconforming patients hear, "The doctor will see you now," they will say to themselves, Yes, and they really do see me.